our organization and particularly our physicians and care team members would never go back. Their work has been made easier. There's less waste, higher quality, better, more safety. The patient and team member experience has clearly improved. And as we know, our processes are so full of waste that if you adopt a method like we did that's focused on taking out that waste, quality goes up, cost goes down, and in my opinion, that's the holy grail. That's what we're looking for.
Welcome to A&M Healthcare Industry Group's What's Your Moonshot podcast series, where world-class healthcare leaders seek to solve big problems. Listen as we talk to today's health system CEOs about the journey to achieve their moonshots.
Dr. Kaplan, I'm John McLean, be co-hosting here with Dr. Shulkin, and an honor to meet you and really excited for the conversation today.
Thank you, John. It's nice to meet you as well.
And Gary, you know, there's a lot of people in healthcare, but I think you're one of the leaders that many of us really look up to try to figure out where we go from here. And so I'm really pleased that you're spending time with us today. For those of you who are listening today and don't know Dr. Kaplan, which is probably only a small number of you, I think you know that he serves as the chairman and CEO of the Virginia Mason Health System in Seattle since 2000. And now, of course, Virginia Mason is involved in even much bigger things. And even despite all of the work that Dr. Kaplan does, he still finds time to put on a stethoscope and a white coat and is a practicing internal medicine physician, as I am too. And I think that's so important in keeping grounded in the work that you do, Gary. So thanks so much for being with us. I just wanted to, introduce a little bit about this podcast to you, Dr. Kaplan. It's called What's Your Moonshot? And it really features healthcare leaders that are bold enough to have audacious goals to make a difference in healthcare. And I know that it must be, 20 years ago, you were one of those that were bold enough to think, how could we dramatically improve the quality of healthcare? And you decided to look outside of healthcare to figure out how to do that in the industrial processes from companies like Toyota. So looking back at the beginning of that journey, and now knowing where you are now, where Virginia Mason is and what you've seen happen in healthcare, what would you say the impact of that is? I mean, would you say, Gary, that studying outside industries like the Toyota production process has really had a big impact on the delivery of healthcare in the Virginia Mason system?
Well, thank you, David, and thanks for having me. It is a real pleasure to be with you today. And I think the answer to your question most definitely is yes. At Virginia Mason, we are now 20 years into consciously deploying a management system predicated on the Toyota production system. And one of the things I'm actually most proud of is the willingness of our team to be willing and able to look outside healthcare for solutions. You know, I'm so proud of American medicine, as I know you are, and yet we know we can be better. And we have to get out of our own skin and realize that we don't have all the answers right here in our own industry and profession. There's a lot of great work going on in other companies, whether it be manufacturing or other industries around the world. Let's be lifelong learners and be willing to look outside. And so that's what we did 20 years ago. And today, our organization and particularly our physicians and care team members would never go back. Their work has been made easier. There's less waste, higher quality, better, more safety. The patient and team member experience has clearly improved. And as we know, our processes are so full of waste that if you adopt a method like we did that's focused on taking out that waste, quality goes up, cost goes down, and in my opinion, that's the Holy Grail. That's what we're looking for.
All right.
That's great. And Dr. Kaplan, so, going back a couple of decades when you embarked upon this journey, what was it as a leader and as a clinician that you thought, wow, this is the journey, the path for us? Why and how did you come to that decision? And did you realize at the time that this was your moonshot?
Well, it's interesting. I think that it started with really realizing that the status quo was unacceptable, that the number of defects, the Institute of Medicine report had just come out in 1999, Terra is Human, and in 2001, as we know, Crossing the Quality Chasm. And here I was as a new CEO in an organization that I had been very much part of. I've spent my entire career, 43 years at Virginia Mason. But there I was 21 years ago as a new CEO with a board saying, you say the patient is your customer, but if that were the case, why do things look the way they do? And we began a deep dive on our processes. We realized they were designed around us, not around our patients. We created a new organizational vision, which was around quality at a time when many of our competitor organizations were looking at market share dominance, getting bigger. And then we were faced with the question, if our vision is to be the quality leader and redesign our care around our patients, how are we going to do that? By what method? And I personally went and looked at many of the great academic institutions in this country, and nobody really had a management system. And that's what we learned from Boeing, ironically Boeing today, but Boeing 20 years ago, who had adopted the Toyota production system, had taken the assembly time for a 737 from 21 days to 11 days, made it faster, safer, higher quality, and less expensively. And we said, wow, maybe there's something here for healthcare. And we began to dive deeper, took our entire executive team to Japan in 2002. That turned out to be the first. I had never been to Japan at the time, turned out to be the first of now 19 similar trips where we spent 2 weeks working in the factories. David, we'd love to have you on one of our Japan trips. I think you'd find it very interesting. And we came home and said, from that first trip, and said, this is going to be our management system. And so that's what the last 20 years has been about. But it was being willing to look outside healthcare because we weren't sure that healthcare had the answers that we needed if we really wanted to execute on our vision around quality and safety and patient experience.
Gary, when you have a success like what you've had, and I think anybody would have a hard time arguing that you haven't implemented a much, much better way of running a healthcare system. But when you have that and, you now look at it, it seems easy. People say, well, of course, that makes so much sense. But back when you were doing this, when you took your first trip to Japan, I bet not everybody thought that you were that brilliant. There were a lot of skeptics. What's this guy doing, spending his healthcare dollars, flying everybody over to Japan? And, this isn't the way to do it. So we're thinking about lessons that other people who are dreaming big now, people younger than us,
Absolutely.
who are going to be having a big impact on healthcare in the future. And thinking back to those days when you first started talking about this, what was the reaction of your colleagues, and how did you deal with people that were skeptical?
Well, I think your assumptions are right on. This was met with a lot of skepticism. I mean, have they lost their minds? What are they thinking? People aren't cars or airplanes. And so I think that and having lived and worked at Virginia Mason for the first 20 plus years of my career before this, I wanted everybody to come along. These were my friends, my colleagues, my mentors. And so I worked hard to make that happen. In fact, I was criticized by some of our executives who said, why are you spending so much time listening to people and trying to help them come along? And not everybody could, but I think it was a time where we needed to deeply engage. We needed to understand the why. We needed to examine our legacy expectations. And so we went through a process, even before we discovered the Toyota production system, of creating a new compact, particularly with our doctors. The old ideas, the old deal, which was a sweet deal, entitlement, protection, and autonomy. That was, my dad said, go into medicine, even if you work for an organization, you're going to be your own boss. That deal didn't sync up with teamwork, collaboration, electronic health record, a laser focus on safety. And so we needed to create new compacts, have that deep discussion. And so I would say sometimes you have to go slow in order to go fast. And so the process that we took in those early years, we engaged physicians where they were. We devised approaches that allowed them to touch the methods and tools and then to self-discover how it was applicable to their work. And soon it became not just an affair of the head, but an affair of the heart. And it became very passionate and emotional for so many of our team members that finally there was a way that frontline team members, including our doctors, could redesign their own work. I don't know the rocks in the shoes. I don't know where the defects are up in the C-suite. But what I know is that the people closest to the work, they're very aware. And so empowering them, providing the tools and the method really helped us jump that curve in the early years. And I think it taught me a lot as a relatively new CEO. It taught me about the power of listening, the power of curiosity, learning about humble inquiry and helping genuinely being interested in helping people engage by asking questions that I didn't know the answers to and needed to. And so lots of lessons. And maybe the last thing I'd say to this point is that unless you change the minds of leadership, these initiatives will not be sustainable. So much of quality improvement starts in the middle of organizations and then they butt up against the C-suite. And the C-suite's focused on M&A, mergers and acquisitions, and on new property and ROI, and unless the C-suite's engaged in this kind of transformational work, it won't be sustainable.
Yeah. I think that's incredibly insightful, Gary, and some amazing lessons for future leaders. One of the things you didn't mention, but I know when you start out on something as big as what you were starting out on, you have to have some type of confidence that you're right. But how long was it before you said to yourself, you know what, this actually might work? People might actually begin to start seeing that this is having an impact. Was it right from the beginning, or did it take you a while?
Well, obviously I didn't know what I didn't know. And so early on, our curiosity was piqued. We said, wow, maybe there's something here. And we took the entire executive team, this was before our Japan trip, to a company in Hartford, Connecticut called Wire Mold. And they were one of the leading lean companies in the world. And many of our executives, I grew up in Detroit, so I spent time in factories. But many of our executives never been in a factory. And what they saw blew them away. These frontline factory workers saying, before we did this, I had no control. Nobody cared what I thought. I just came and I was like an automaton. Today, I am the one that comes up with the innovations on my part of the line. And that was really exciting for this healthcare leadership team. And then when we went to Toyota and saw the symphony that Toyota had really become, where everything was interlinked, no waste, and every team member was empowered to stop the line. Every blue collar factory worker could shut down the factory. And what are we doing in healthcare? A month, 2 months after the fact, retrospective quality assurance. We came home and said we want to treat our patients at least as good as Toyota treats their cars. And so it was at that point that I said, I don't know if this is a bet the career move. Paul O'Neill called it a bet the farm move. But I said, full speed ahead. We'll never know unless we totally dive in. And seeing that symphony, it just said to me, this is what's possible. And we're still working on it. Everybody's still working on it that's in this space. But you see what's possible. And when you have those glimmers, it just sort of says, wow. And so now I think about how do we scale this even more?
Yeah. That's fantastic. Collaboration, engagement, empowerment, those sounds like some of the core tenets that drove the success. Are there other elements that we haven't alluded to yet that were really sort of the core drivers of your success?
Yeah, there's many. I think one that I would very, very strongly emphasize is respect for people. When you look at the Toyota production system, it's really propped up by two pillars: continuous improvement, a belief that no matter how good you are, you can keep getting better. And that we have, in fact, to that point, we ask every leader to come to work every day with two jobs: run your business and improve your business. So that continuous improvement pillar. But the second pillar, respect for people, is foundational. It's critical. And so, interestingly, we were 10 years into this journey. We had already gotten a lot of recognition, and people were quite proud, and they said, we got to accelerate our work. When Lucian Leap came to visit us, it was the third time that Lucian had come to visit us. And as many of you know, Lucian is thought of by many as kind of the grandfather of patient safety. And Lucian said, Gary, you guys are good, but you haven't cracked the nut. And I said, well, what are you talking about? He said, respect. It's the silent killer in our workforce. And we've got a disrespect in healthcare that needs to be addressed. So we said, well, let's check this out. And so we convened some focus groups. I didn't enjoy what I heard, but I heard that even in a place like Virginia Mason that had been on this journey for a decade, there was still subtle disrespect. And so we put together, interestingly, mandatory respect for people training for all of our people, including all of our physicians. We hired an improv acting troupe from Seattle, and they acted out vignettes that had been written by Virginia Mason team members. And it was multidisciplinary learning. So I was in my session, I had a dietary worker and a housekeeper at my table. And so here we were, the leadership, the physicians, frontline team members, all learning about respect. And we each had to commit to 2 of our 10 respectful behaviors, tell our supervisor and our direct reports what we were working on. And everybody in the organization knew that I was working on listen to understand and walk in their shoes. And I'm still working on those respectful behaviors. But again, a lot of people think of a lean, so to speak, as a mechanistic, proscriptive, top-down system, and it's quite the contrary. It's empowerment of the front lines. It's predicated on deep respect, and I think that's going to be what continues to engage and accelerate this work amongst teams across healthcare organizations around the world.
Great. Gary, we just come through the pandemic for a lot of organizations, including yours. This was an unparalleled challenge to go through it. And I wonder, in terms of your leadership and your quest to change healthcare, are you still on the same moonshot, that is learning as you said so many times in this podcast, how to listen and do better? Or have you developed a new moonshot, in terms of disparities of communities or in terms of, a new way of approaching healthcare? Do you have a second one in you, or is it still continuing along with your first?
Well, it's an interesting question. And I have thought about this because,
Yeah.
we all, particularly when you get to our stage in our careers, we want to have an impact, and it's all about impact.
Yeah.
And so in many ways, my second moonshot, or what you might term my second moonshot, is a continuation, but a logarithmic acceleration of the first moonshot, and brings to focus many of the things you just mentioned. I mean, realizing in the pandemic, brought us face to face with disparities, the inequities in healthcare today, as we know. And, we all knew about it, but it was in some ways an abstraction until you see it around you every day, which we did with COVID. And so for me, what I'm most focused on now is how do we accelerate the work? How do we scale this in ways that I never really envisioned at the beginning? I mean, my focus was how do I transform an organization that I had the privilege to lead and that I had a deep love affair with in many ways. Today, as you likely know, we're part of Virginia Mason Franciscan Health. We decided to create a bigger system here in the Pacific Northwest. That system is part of Common Spirit nationally. One of the reasons we did this was a belief from my colleagues at Legacy Franciscan that they too wanted the Virginia Mason production system to be their management system. So we are now just scaling this across 11 hospitals. And as I think about, and through our institute, we long ago demonstrated proof of concept, working with hospitals across the US, in the UK, Europe, and elsewhere. But now we have a chance to really do it right here in our region of the country and potentially use that as a platform across the entire Common Spirit system. So lots of opportunity. And I think, again, for me today, it's about impact. And how do we get closer to that perfect patient experience for every patient, every time, and have that opportunity for more patients and more communities. And then we may get closer to transforming healthcare, which is, why I know you do what you do and I do what I do. So.
Thanks. Great.
Dr. Kaplan, thank you so much for your time today. It's an honor to have the chance to speak with you. I'm actually an industrial and health systems engineer, so I'm been completely just geeking out at this whole experience, and it's just phenomenal to have the chance to talk to you. And thank you so much for your time. So great to hear about your first moonshot and where you're going with your second.
Yeah.
Well, my pleasure, and thanks for the opportunity.
It's amazing.
Let me know when, where, and how I can watch this,
Sure.
or have other people.
We will.
And it's great to see you guys. And
thank you.
I look forward to seeing you again soon.
Thanks, Gary.
Take care.
Bye-bye.
Thank you.
Alvarez and Marcel. Leadership, action, results.